I'm Dr. Andrew Iraniha, and I'm the founder of the DRI Tuck procedure. When people hear the term tummy tuck, they often assume it's a standard cosmetic procedure focused mainly on removing excess skin. But in reality, many problems patients experience after pregnancy or weight changes are actually related to the structure of the abdominal wall, a condition called diastasis recti, where the abdominal muscles separate. The DRI Tuck was developed to address the abdomen in a completely different way than traditional tummy tuck techniques. Instead of focusing primarily on skin removal, the procedure focuses first on restoring the structure and the strength of the abdominal wall. After more than 25 years practicing surgery, much of my work has centered around minimally invasive and laparoscopic techniques. With the DRI Tuck, the diastasis recti repair is performed laparoscopically, allowing the abdominal muscle to be brought back together from the rib cage all the way down. This creates what is essentially an internal corset, restoring strength and stability to the core. At the same time, we address the aesthetic components that matters to the patient, including skin laxity, waistline contour, and the appearance of the belly button. One of the major goals of the DRI Tuck is to make the procedure less invasive while achieving stronger structural results. The technique is drainless, the scar stays within the hip, recovery is smoother, and in many cases, we are able to preserve the patient's natural belly button, which helps maintain a very natural appearance.